In our studios is a very prominent physician in our community, and I'd like to introduce her to you rather. Her name is Dr. Anne-Marie McDonald. Welcome to this very special program, which is sponsored by Neighborhood Health Providers. Well, you're one of the prominent physicians in the Neighborhood Health Providers network. But before we get into your affiliation, maybe you can enlighten our viewers a little bit about yourself, your practice, tell them a little bit about who you are.
Okay, as she says, my name is Dr. Anne-Marie McDonald. I've been in the Richmond Hill community for several years now, more than 10 years, and I've come to grow to love the people there that I serve. I work at 12901 Liberty, that's in Richmond Hill, and we see a lot of patients with many different problems.
Well, I know you've been affiliated with Neighborhood Health Providers for quite some time. What is your association like with this very prominent insurance company?
Well, as she says, we've been affiliated with the Neighborhood Health Providers for many years now, and we have seen that our membership have grown, and we have been able to service those people in a very good way. The Neighborhood Health Providers have given the clientele a lot of options. They have provided comprehensive care, and they have worked very closely with myself and the staff in our offices.
Well, that is absolutely wonderful to hear that firsthand from a physician that's part of the NHP network. NHP, of course, Neighborhood Health Providers, for those of you that are wondering. You know, it's so crucial for people to recertify their coverage, doctor. I'm sure you have patients that come into your office and did not even realize that their coverage expired or lapsed. And the purpose of our special segment today is really to encourage the folks out there that have Neighborhood Health Provider as their insurance company to recertify your coverage before it expires. And what they need to look for is that renewal packet, correct?
Right.
And to really complete that paperwork in a timely manner. As soon as you receive that packet in the mail, just complete it, and it will guarantee you that you will have your coverage renewed for the following year. You've seen patients come in, I'm sure, where they didn't realize that their coverage expired, right?
Absolutely, and unfortunately we are not able to service those people. So it's very important, just like how you have your annual mammogram, your annual pap smear, it's also very important that you really complete this package and mail it as soon as possible. You could probably drop it off to any one of those vans that you see located all around your neighborhood.
The Neighborhood Health Providers, but more importantly, you can even go down to their locations, and there's one that's conveniently located on Liberty Avenue. That's 11919 Liberty Avenue in Richmond Hill, Queens, and they'll even assist you in completing the paperwork. So don't get all frazzled, you know, with all these sheets, and really it's very minimal number of sheets that's in the packet. So if you need help, the number is up on the screen. You can certainly call that number or head down to your Neighborhood Health Providers office in the heart of Richmond Hill, Queens. Well, Dr. McDonald, you are from the island of Jamaica.
Right.
And you've been serving the West Indian Caribbean community here for many years. And from what I've been hearing, she is so well loved by the patients. And as she mentioned earlier, many of the patients have Neighborhood Health Providers. So I want to encourage all of you out there, if you haven't yet enrolled, for new members, call the number on the screen and enroll for the Neighborhood Health Provider coverage. And I wanted to add that it's a coverage that would probably be at no cost to you. To find out more, call the number, and they'll be more than happy to share all the information with you. Dr. McDonald, I wanted to ask you about the treatment of high blood pressure. A lot of people from the Caribbean suffer with high blood pressure. And I wanted to ask you to give some insight on this condition.
Absolutely. High blood pressure or hypertension is very common in the community, especially in non-white, non-Anglo-Saxon, which is the blacks, Guyanese, Trinidadians, and it's also called the silent killer. And the reason why it's called the silent killer is that you really are walking around and you have no idea that your blood pressure is that elevated. The bad thing about it is that people usually recognize the symptoms of high blood pressure, which could be a stroke a heart attack, renal failure, kidney failure, that sort of thing, dizziness, and sometimes those symptoms are too late. And that is why we encourage each person to have insurance so they can have easy access. And of course, neighborhood health provider is one that is very, very accessible in our community, and you can easily enroll. And once you have that insurance, you can make a call to the office, which is located in the neighborhood, and you will come to see us. And there's lots of ways to treat high blood pressure. And not everything requires medication, but it does require monitoring. And because of this monitoring, we do encourage our patients to come in regularly so that their blood pressure can be checked. Not only that, you could probably check your high blood pressure in between doctor's office at one of those vans that are located easily all around your neighborhood. You can also go to a local pharmacy and check your high blood pressure. There are also blood pressure machines that are usually covered by your insurance. And so these are ways that we can use to control high blood pressure. Of course, besides that, we do have medications which are available, but I do like to encourage not only medication, but diet and exercise changes, because those things you must incorporate for a well-balanced life.
Absolutely. Well, that was, quite comprehensive in sharing your insight. But again, for those of you that may have lost your coverage due to losing your employment opportunities, you can absolutely call neighborhood health providers. The number's up on the screen, and you may qualify for this coverage. You have nothing to lose, but everything to gain.
Absolutely.
So I'd like to encourage all of you who don't have coverage and are seeking coverage to allow neighborhood health providers to be your choice insurance company. The level of benefits is very comprehensive. They're affiliated with top-notch board-certified physicians like Dr. McDonald. They're associated with many of the top hospitals in your community. They're not cutting corners here. It's a full-service insurance company that wants the best for the community. And we're going to take a break. We'll be right back with more from Dr. McDonald. Don't go away. Stay close.
Hi, I'm Dr. Marie Bellot, your neighborhood doctor. As an internist, it is great to work with neighborhood health providers since no referral is needed for my patient to see any specialist within the network.
These health programs provide benefits that care for you and your loved ones, with visits to your primary doctor provider, emergency rooms, radiology exams, specialist visits, and much more. Neighborhood provides Child Health Plus, Family Health Plus, and Medicaid coverage to hundreds of thousands of families. Neighborhood is the health plan you know and trust. Neighborhood is associated with some of the top doctors, dentists, and hospitals in our community. Applying for Neighborhood is easy. For more information, call 1-800-826-6240. Neighborhood is the plan you know and trust.
Hi, I'm Dr. Rana Suleiman, primary care provider. It is great to work with neighborhood health providers. Neighborhood makes life easier for my patients as no referral is needed to see the specialist within the network.
And I am Dr. Javed Suleiman, your neighborhood cardiologist, and I also accept neighborhood health providers.
Applying for Neighborhood is easy. For more information, call 1-800-826-6240. Neighborhood is associated with some of the top doctors, dentists, and hospitals in our community. Neighborhood is the plan you know and trust. Neighborhood provides Child Health Plus, Family Health Plus, and Medicaid coverage to hundreds of thousands of families. Neighborhood is the health plan you know and trust.
Well, for those of you that have just joined us, we're sitting, interviewing, having a discussion with Dr. Anne-Marie McDonald, and she is a neighborhood health provider physician, and she was actually enlightening you just a few minutes ago about high blood pressure, hypertension. Dr. McDonald, what are some of the symptoms that people should look for being hypertensive?
Okay, one of the common symptoms that one may find is that you may have a headache, and that headache is really not going away. The other thing that you may get is that tensed muscle in the back of your neck. Those are some of the symptoms. Another one is dizziness, lightheadedness. Some people even get nausea. So we want you to be aware, especially when you're getting this on a regular basis, you need to visit your physician. And again, if you have neighborhood health providers, you have a provider such as myself who is easily accessible. We have our telephone numbers easily accessible on the card. You can call us and make an appointment as soon as possible.
And in your office, you also have an OBGYN as well.
Absolutely. We have the woman's physician specialist who is called an OBGYN, and we take care of all your pregnancy needs, all your GYN needs, and we do a comprehensive service to the people and members in the community.
Well, I know that you've been practicing medicine for many years, and she's actually a very well-liked physician in our community. So her office information is up on the screen. Again, she is one of the proud physicians of Neighborhood Health Providers, been associated with them for many years. This is a very credible insurance company, and I want to encourage all of you out there that have your coverage. Remember, it's extremely vital. I cannot stress it enough, Dr. McDonald. You can, really attest to that.
Absolutely.
Because if you don't recertify your coverage lapses, and you may not even realize that you have no coverage until you get to the doctor's office. So you need to look for the renewal packet in the mail. As soon as it comes in, we're trying to appeal to all the members out there. Complete the paperwork, or if you need help in completing the paperwork, the toll-free number is up on the screen. Or the other option is, if you want to pop by at the community office of Neighborhood Health Providers, they're located at 11919 Liberty Avenue in Richmond Hill, Queens, and a representative there will be more than happy to assist you. Dr. McDonald, I am absolutely looking forward to hearing some good results of lots of new patients coming in and consulting with you. In meeting Dr. McDonald, I have to tell you that she's extremely personable. She truly cares about her patient, and you're not going to be just a number. So please do contact her as a general practitioner, and she also has an OBGYN in her office as well. In closing, is there anything you'd like to say to our community out there?
I would like to say it's really an honor, and I'm very proud to serve the people in the Richmond Hill community and the nearby area. I'm very proud of my affiliate with the Neighborhood Health Providers. They've worked closely with us. Whenever we have a question, they're there for us in the office, and they'll be there for you. So please don't forget to keep your certification up to date, and please fill out the forms as soon as you get it, so that you will make life easy for yourself and for the office. Thank you.
Well, thank you so much, Dr. McDonald. It's our pleasure having you here. And when we come back, we'll be interviewing Dr. Shazia Sami, also affiliated with Neighborhood Health Providers. Coming up, don't go away, stay close.
I'm Dr. Hannah Sijal, an OBGYN. It's great to work with Neighborhood Health Providers. My patients come to me as they know that they receive excellent care and they do not have any hassle with their insurance plan.
Neighborhood is associated with some of the top doctors, dentists, and hospitals in our community. Applying for Neighborhood is easy. We have 2 locations in Richmond Hill, Queens, 11915 Liberty Avenue and 12201 Liberty Avenue. For more information, call 1-800-826-6240.
Hi, I'm Dr. Tina, your neighborhood dentist. Yes, my patients, they have a brighter smile thanks to dental benefits of Neighborhood. Good thing about neighborhood patients is that they don't need a referral to see a dental specialist.
Neighborhood provides Child Health Plus, Family Health Plus, and Medicaid coverage to hundreds of thousands of families. Neighborhood is the health plan you know and trust.
Welcome back to a very special segment, which is being sponsored by Neighborhood Health Providers, your #1 choice when it comes to healthcare coverage. And with me is Dr. Shazia Sami. Dr. Shazia Sami, welcome to our program.
Thank you.
And it's our pleasure to have you. And you have been affiliated with Neighborhood Health Providers for quite some time. But first, I want to ask you to introduce yourself to our community. Tell our viewers a little bit about yourself and your practice and your affiliation with NHP.
Sure. Thank you so much, Tanuja, and thank you so much, Neighborhood Health Plan. It's inviting me here on this platform so that I can explain about the Neighborhood Health Plan services, as well as about my office locations and my services. I'm a board certified family practice, and since 2006, and I was working in the hospital, and now for the last 2.5 years I've been in the Richmond Hill area and serving the community. There is a mixed community with the West Indians and the Trinidadian and as well as the Asian community, including the Indians and Pakistani Arabic countries. And so I'm very happy in this area because the patients population is with a mixed variety, as well as the neighborhood health providers services. The patients with the neighborhood health providers, they are very happy, and because they are getting the services as soon as they call, the members are very representative, are very active. So I'm very happy with the plan, as well as my location and the services here.
Right, and I know for sure that neighborhood health providers, they actually recruit, doctors who are board certified with great credentials like yourself. So I just want to assure viewers out there that the doctors are fully accredited. They are, top-notch physicians. Also, neighborhood health providers is associated with many of the leading hospitals in your community. As you know, you're affiliated with hospitals as well, and you've had no bad experience working with neighborhood health providers, and you have many patients that come in through the neighborhood health providers coverage, correct?
Yes, for the last, I'm here for more than 2 years, but I'm increasing in this community. And but over the time, my number of patients are increasing, and the reason because they like the neighborhood health plan, and because I'm the pediatrician also, so the number of the children are also increasing. Because the family, they have the neighborhood health plan, so they like the plan. They so enroll their kids also in this plan.
Absolutely. Yeah. Well, I just want to encourage you. It's time to recertify your coverage. If you have that packet that came in the mail recently, that renewal packet, please do not have it sitting around on your dining room table. It's time to fill it out, send it back as soon as possible before your coverage lapses. And if you need help in completing that paperwork, it's really not cumbersome. You can call the toll-free number up on the screen, or you can visit the neighborhood health providers location in Richmond Hill, Queens. The address is up on the screen. It'll be more than happy to help you in completing that paperwork, because you don't want to know that the next time you visit Dr. Sami at her office, your coverage has lapsed. You certainly don't want that. Well, Dr. Sami, I wanted to actually ask you to talk a little bit about the symptoms of diabetes. As you know, many Caribbean nationals, South Asians, we suffer with diabetes.
Sure, Tanuja. Yeah, the diabetes actually is a very complex disease, and it is because of it's not a simple disease. It's a complex with the genetic as well as environmental factors, and it's very sad because since in 1987, when we checked our statistics, so we had only 30 million people with the diabetes, but in last year 2010 it increased to 285 million people with the diabetes. And according to the Diabetic Federation, they are saying that it's going to increase to 485 million in 2030. So it's very sad, and it's very worrisome that how we can do and to decrease and control the diabetes. And so diabetes has actually is the type 1 and type 2. The type 2 is more worrisome because it is increasing, and it's 90% of diabetes is covered with the type 2, and only 10% is type 1. And the reason for the type 2 is because of the obesity, and we had a change of lifestyle, and we have the increase the nutritionist, we have the more obesity and the nutrition, as well as that we're not doing any exercise.
Right. And I also wanted to interject that even in children, because you also handle a lot of pediatric cases, in children there there's significant amount of diabetic cases within the
last couple of
children.
years. And in the next couple of years, diabetes will increase in the adolescents and the young children. And our target is for between over 45 years of age, because the type 2 diabetes is increasing in that individuals. And as we go for the symptoms, there's actually type 2 diabetics is, unfortunately, there is no symptoms. They are very asymptomatic, so it's underdiagnosed.
I see.
So if they don't go for the physicals, annual physical, they will never be diagnosed unless that they hit any kind of complication, very bad infections. So that's why I strongly recommend for all the adults and the children also, they should go for the annual physical. And it's possible if they have insurance, and the neighborhood health plan, it provides all kind of comprehensive care with all the labs and X-ray, radiology, all specialist care coverage. So the patients, they should enroll in that neighborhood health plan, as well as if they get their package for the recertification, they should right away, they should send the packet back.
Exactly.
So that there is no delay, there is no lapse in their coverage, and so that they can get their medication.
Very important, absolutely. Because if you are diabetic, you are hypertensive, you need to be able to get your medications, you know, in a timely manner, and not be told that you have no coverage. So you should understand the urgency in making sure that your coverage is renewed. And many times, from what we've been told, patients go after the fact, after the deadline of their renewal recertification, and then it's too late, and then you have no coverage. And at that point, neighborhood health providers will not be able to help you to reinstate your coverage. So very important. It takes basically 10 minutes to complete the forms, put it back in the mail, and get it out to neighborhood health providers. You'll have that peace of mind knowing that you have the medical coverage you need and your family needs as well. And as Dr. Sammy is a pediatrician, you certainly don't want to leave your children without coverage. It is so important, especially the winter months are here, the flu season is here. You know, people tend to get a lot sicker during the winter months, and it's very important that you have coverage during this time. We're going to be right back with more with Dr. Shazia Sami. Stay close.
Hi, I'm Dr. Rana Suleiman, primary care provider. It is great to work with neighborhood health providers. Neighborhood makes life easier for my patients, as no referral is needed to see the specialist within the network.
And I am Dr. Javed Suleiman, your neighborhood cardiologist. And I also accept neighborhood health providers.
Applying for Neighborhood is easy. For more information, call 1-800-826-6240. Neighborhood is associated with some of the top doctors, dentists, and hospitals in our community. Neighborhood is the plan you know and trust. Neighborhood provides Child Health Plus, Family Health Plus, and Medicaid coverage to hundreds of thousands of families. Neighborhood is the health plan you know and trust.
Hi, I'm Dr. Marie Bellot, your neighborhood doctor. As an internist, it is great to work with neighborhood health providers, since no referral is needed for my patient to see any specialist within the network.
These health programs provide benefits that care for you and your loved ones, with visits to your primary doctor provider, emergency rooms, radiology exams, specialist visits, and much more. Neighborhood provides Child Health Plus, Family Health Plus, and Medicaid coverage to hundreds of thousands of families. Neighborhood is the health plan you know and trust. Neighborhood is associated with some of the top doctors, dentists, and hospitals in our community. Applying for Neighborhood is easy. For more information, call 1-800-826-6240. Neighborhood is the plan you know and trust.
Well, we're conducting a very special interview with Dr. Shazia Sami. She's an affiliated physician with Neighborhood Health Providers, your #1 choice when it comes to healthcare coverage. Before we continue with our discussion with Dr. Sami, I wanted to encourage those of you out there that do have Neighborhood Health Provider coverage, and for some reason you were lackadaisical where you did not complete that renewal package. I'm sure there are many out there that are guilty of that. I want to encourage you that it's not a hopeless case yet. call the toll-free number up on the screen or visit the Richmond Hill location, and the representatives there will try their very best to help you to reinstate that coverage. There's no guarantee, but they will absolutely do their very best to help you. The last thing they want to see is a member of NHP not having the insurance coverage that they need. So this is just one example of how neighborhood health providers, they bend backwards for their members. They want you to have the coverage that will make a difference in your life and your family's life, because medical coverage in America is crucial. You all will agree with me on that one. Dr. Sami, you've seen many patients that have the neighborhood health providers. What is their overall satisfaction with the plan?
If we rate for the satisfaction, the 5 is the highest, and there I will give the 5 because the patients they are getting the comprehensive services, including the dental, and so I will rate 5 because all the patients are most satisfied.
Beautiful. Yeah. Well, we were talking earlier about diabetes 1 and diabetes 2. Maybe you can touch a little bit about diabetes 1 and some of the symptoms affiliated with that.
Yeah, the type 1 diabetes is actually common in the young children and as well as the adolescents and the young age, and it's common in the females as well as males. And but the difference is usually the type 1 diabetic patients, they are diagnosed when either they are in coma or they are very high sugar. Incidentally, they check with the regular exams, regular physical exams and the blood test, or if they have very severe infections and they ended up in the hospital. Then they are in the young age, they have to start with the insulin because the medication doesn't work. The oral hypoglycemic are not work with the type 1 diabetics because they don't have the insulin in the body that can produce insulin to control the sugar.
Right, and I guess one way of controlling diabetes is through a weight loss and having the right nutrition in your diet.
Yes, correct, Tanuja. I have actually this is a very good point because of all type of diabetics, they can control their sugar with the weight loss and the increased lifestyle and increasing the physical activity. I have the weight loss program in my office, and that is a very convenient and very easy, safe to use, and there's no side effects, and it's safe for the diabetics, hypertensive and hyperlipidemic patients. And that program actually decrease the diabetes as well as hypertension and cholesterol control. And it's safe for the children because the obesity is common above 12-year-old, and it's easy to use with the adolescent also.
Well, this is just an indication of the prominent and well-accredited physicians that the neighborhood health providers have in their network. Dr. Shazia Sami, you've just heard her. She's extremely knowledgeable and brilliant physician. These are just you're just getting a taste of some of the brilliant doctors that are in this network. And as I mentioned earlier, NHP, neighborhood health providers, they're also associated with many top hospitals in our community. Well, Dr. Sami, I want to thank you for being on the segment here as a proud physician of neighborhood health providers. Let NHP be the #1 choice when it comes to your insurance company. They have been serving our community for a very long time. They're passionate about our community. They're passionate about helping the people in our community to have the coverage, the health coverage that you deserve. And I want to encourage you once again, call the number up on the screen if you're seeking new coverage or if you're recertifying your existing coverage. Do not wait. Do not procrastinate. And you can also visit the local Richmond Hill office as well. That phone number, the address is up on the screen as well. And you will certainly be pleased with the level of medical coverage that will be rendered to you and your children, your entire family, by neighborhood health providers. Thank you for watching our segment today, and we hope that it was very informative to you.
Applying for Neighborhood is easy. For more information, call 1-800-826-6240. Neighborhood is the plan you know and trust.